Morning movement timing and preparation become critically important after age 50 due to physiological changes affecting joint readiness and spinal sensitivity upon waking. Today we're covering 4 gentle preparatory movements superior to immediate walking for morning body awakening: arm swings with heel raise for circulation activation, chest opening with step back for posture restoration, gentle spinal twist for rotational mobility, and chest expansion with heel raise for balance training. These movements address overnight joint stiffness from reduced synovial fluid circulation, forward posture development from daily habits, gradual spinal rotation loss, and balance system coordination. When practiced correctly and consistently, they help prepare joints for larger movements, improve breathing efficiency, restore spinal mobility, and strengthen balance capacity essential for fall prevention. Before we begin, this is educational content, not medical advice. Always consult your healthcare provider before starting new exercises, especially if you have cardiovascular conditions, severe joint problems, balance disorders, recent injuries, or chronic health conditions. Understanding morning physiological state after 50. After full night's sleep, body exists in significantly different state than later in day, with joints exhibiting greater stiffness, spinal discs showing increased hydration making them more pressure sensitive, and muscles remaining incompletely warmed. Research from Harvard Health Publishing and American College of Sports Medicine demonstrates joint lubrication and mobility improve gradually once body begins moving gently. When immediately initiating longer walks or stronger movements, body sometimes lacks readiness, causing people to notice tight hips, stiff backs, or uncomfortable shoulders. Understanding this physiological reality proves essential for appropriate morning movement sequencing. During sleep, body reduces movement for several hours, meaning synovial fluid, the natural joint lubricant, circulates more slowly. National Institute on Aging and American College of Sports Medicine research shows gentle mobility movements stimulate this fluid and prepare joints for larger movements later in day. Additionally, circulation benefits from gradual movement initiation as muscles act like small pumps moving blood toward heart, improving oxygen delivery to brain and muscles, making entire body feel more awake and coordinated. Spinal mobility proves particularly important as spine supports nearly every movement, yet many adults gradually lose flexibility in upper and middle back over time. Gentle rotations and arm movements help restore mobility and reduce stiffness, explaining why traditional longevity routines begin with rhythmic low-impact movements involving entire body. Movement 4, arm swings with heel raise for circulation activation. Despite appearing deceptively simple, gentle arm swings combined with small heel raises activate several important bodily systems simultaneously. Natural arm swinging loosens shoulders and increases upper body blood circulation, while slightly lifting heels activates calf muscles, sometimes called body's second heart because they help pump blood toward heart. Mobility research referenced in senior fitness programs and by American Council on Exercise shows rhythmic full-body movements improve circulation, coordination, and joint lubrication without placing joint stress. For adults over 50, movements like this gently and effectively wake shoulders, spine, and lower legs before attempting more demanding activities. Stand upright with feet approximately shoulder width apart, knees relaxed, posture tall as if string gently lifts head top upward. Begin movement by swinging one arm upward while other swings downward. Simultaneously, slowly lift heels rising slightly onto feet balls. Lower heels back down as arms switch positions. Movement should feel smooth and rhythmic, neither forced nor fast, like gentle wave traveling through body from feet through spine and out through arms. Breathe naturally while moving. Many find comfortable pace by counting slowly mentally. Perform approximately 20 to 50 repetitions depending on comfort level. Common mistakes include lifting heels excessively high or moving arms too aggressively, when goal emphasizes coordination and flow rather than intensity. Another mistake involves locking knees when keeping them slightly relaxed protects joints and maintains movement fluidity. After brief set, many notice shoulders feel looser and legs feel more awake. Movement 3, chest opening with step back for posture restoration. As aging progresses, many people gradually develop forward rounded posture without conscious awareness from hours spent sitting, using phones, driving, or working at desks, causing shoulders to roll forward and chest to tighten. This position limits lung expansion capacity and may place extra neck and upper back stress. Chest opening movement helps counteract this pattern by gently moving arms backward while coordinating step, causing chest muscles to relax while upper back muscles activate. Harvard Health Publishing posture research shows exercises opening chest and strengthening back improve breathing efficiency and reduce upper body stiffness. For adults over 50, restoring natural posture proves incredibly valuable as better posture makes body feel lighter while supporting healthier breathing and improved daily balance. Stand comfortably with feet approximately shoulder width apart, body upright. Begin by gently swinging both arms forward at approximately shoulder height. As arms move forward, lightly bring hands toward each other, allowing them to touch or softly tap together in front of chest. Next, open arms wide to sides and slightly behind body, allowing chest to expand. Simultaneously, step 1 foot backward in small controlled step. Return to starting position by bringing foot forward again while arms move back toward front. Repeat movement in smooth rhythm, alternating legs stepping backward each time. Keep motion relaxed rather than exaggerated with goal of gently opening chest without forcing shoulders into uncomfortable position. Common mistake involves leaning upper body forward when stepping back when instead spine should remain tall with head aligned over shoulders. Another mistake involves swinging arms too quickly. Aim for 20 to 50 repetitions at calm pace, allowing chest to gradually feel more open with each movement. Movement 2, gentle spinal twist for rotational mobility restoration. One of first mobility types many lose with aging involves spinal rotation, the ability to comfortably turn upper body side to side, occurring slowly and quietly over years as daily routines involve less twisting and more forward-facing activities like sitting, driving, or screen viewing. When natural rotation decreases, spine becomes stiff and muscles around waist and back may feel tight. Gentle rotational movement restores mobility to thoracic spine, the middle spine region playing key role in posture and overall movement. American College of Sports Medicine Mobility and Aging research shows maintaining spinal mobility supports balance, coordination, and comfortable daily movement. This simple twisting exercise reintroduces rotation relaxedly, helping back and waist loosen without placing joint pressure. Begin standing upright with feet approximately shoulder width apart. Let arms hang naturally at sides with knees relaxed. Start movement by gently rotating upper body to one side, allowing arms to move naturally with motion. As turning, one hand can lightly touch opposite shoulder while other arm moves behind back or gently taps lower back area. Then slowly rotate body to opposite side, letting arms switch positions in smooth relaxed swing. Key to this movement involves relaxation with arms feeling loose, almost like pendulums, moving naturally as body turns. Avoid forcing twist or attempting excessive rotation as movement should remain within comfortable range, with body naturally becoming more flexible over time. Another important tip involves keeping hips mostly facing forward while rotation comes primarily from upper body and waist. Practice 20 to 50 gentle repetitions, allowing movement rhythm to gradually loosen spine. Movement 1, chest expansion with heel raise for balance training. When considering staying strong with aging, people often focus on muscle strength or endurance, yet researchers now emphasize another ability potentially more important, balance. National Institute on Aging research identifies maintaining balance as one of most effective ways reducing fall risk and preserving later life independence. Balance depends on several systems working together including muscles, joints, inner ear, and nervous system. This exercise gently activates all simultaneously. By lifting heels while expanding arms, body learns controlled self-stabilization. Calf muscles engage, core activates, and chest opens, encouraging upright posture. Despite appearing simple, movements like this train coordination between lower and upper body, becoming increasingly valuable with age. Stand upright with feet approximately shoulder width apart, arms relaxed at sides. Begin by slowly lifting heels rising onto feet balls. Simultaneously, extend both arms outward to sides at approximately shoulder height, allowing chest to open naturally. Hold position briefly for balance and stability moment. Then gently lower heels back to ground while bringing arms back toward body front. Motion should feel controlled and steady rather than rushed. Imagine growing taller when lifting heels, keeping spine long and shoulders relaxed. If maintaining balance feels initially challenging, perform movement near wall or chair for support. Common mistake involves leaning body forward when rising onto toes when instead head should remain aligned above shoulders and shoulders above hips. Perform 20 to 40 repetitions at comfortable pace, focusing on smooth coordination between arms and legs. Over time, this small daily practice quietly strengthens body's balance sense, an ability supporting confidence, independence, and safe everyday movement. Daily practice integration. These 4 exercises require neither gym, special equipment, nor long workout session, with many finding just 5 to 7 minutes daily sufficient for benefit experience. Simple routine can include starting with arm swing with heel raise for circulation awakening, moving into chest opening step back for chest expansion and upper back activation, practicing gentle spinal twist for waist and middle back loosening, and finishing with chest expansion heel raise for balance and coordination challenge. Move slowly, breathing naturally without rushing through repetitions, as movement quality matters far more than speed. Most begin with approximately 20 repetitions per exercise, gradually building toward 40 or 50 as body becomes more comfortable. Consistency creates real change, as small daily movement helps body maintain mobility, balance, and energy over time. Safety considerations and precautions. Do not perform these movements without consulting healthcare provider if you have cardiovascular conditions, severe joint problems, balance disorders requiring assistance, recent injuries or surgery, uncontrolled chronic conditions, or significant osteoporosis. Even for healthy older adults, start conservatively with smaller ranges and slower pace, progressing gradually. Stop immediately if experiencing pain beyond mild stretching sensation, dizziness or balance loss, unusual discomfort, breathing difficulty, or chest sensations. Mild muscle engagement and gentle stretching feelings are normal, acute symptoms are not and require medical evaluation. Realistic expectations and timeline. Benefits develop progressively through consistent practice. Week 1, learning movement patterns, establishing routine, initial body awareness, morning awakening improvement. Weeks 2 to 4, reduced morning stiffness, improved joint comfort, enhanced movement ease, better posture awareness. Weeks 4 to 8, noticeable flexibility gains, improved balance confidence, enhanced coordination, reduced daily stiffness. Weeks 8 to 12 and beyond, maintained progressive improvements, established sustainable morning ritual, clear functional benefits supporting independence, continued mobility enhancement. However, inconsistent practice limits benefits, emphasizing importance of daily gentle practice. Complementary practices for morning wellness. These movements work best combined with gradual wake-up period, avoiding abrupt movements, adequate hydration upon waking supporting tissue function, light breakfast before more demanding exercise, proper footwear or barefoot practice on non-slip surface, well-lit safe practice space, and patience allowing body proper warm-up time. Additionally, consider brief meditation or breathing exercises, gentle stretching after movements, and delaying intense exercise until body fully awakens, typically 30 to 60 minutes post-waking. Monitoring progress. Track both practice consistency and experiential improvements. Practice metrics, days practiced weekly, time required for routine, comfort with movement patterns, ability to complete full repetitions, reduced support needs. Functional improvements, easier morning movement initiation, reduced joint stiffness upon waking, improved daily posture, enhanced balance confidence, better breathing ease, maintained comfortable daily movement. These markers indicate meaningful improvements supporting quality of life and functional independence. Conclusion. These 4 morning preparatory movements provide evidence-based benefits for adults over 50, including activated circulation before demanding exercise, restored chest opening and posture, regained spinal rotational mobility, and enhanced balance coordination. These practices require no equipment, minimal space, take only 5 to 7 minutes, and can be performed safely at home. Start with basic movements using proper awareness. Practice consistently each morning. Progress gradually in repetitions and range. Use gentle approach always. Combined with appropriate exercise timing, proper hydration, and comprehensive wellness approach, these movements support continued mobility, balance, and independence throughout aging process. Thank you for watching. For specific concerns about appropriate movements for your situation, consult healthcare provider or physical therapist for personalized assessment and guidance. Subscribe for evidence-based information on intelligent movement sequencing for older adults, practical guidance prioritizing body readiness while helping you maintain mobility and independence through properly timed gentle practices.